Welcome to Just in Time, a podcast series provided by the Washington State Department of Social and Health Services, Developmental Disabilities Administration. I'm Kenny Davis.
And I'm Robin Wiseman. We will be your hosts for this fun, interactive, and informative podcast specially created for residential providers working to support and transform the lives of people with developmental disabilities across the state of Washington.
Each episode aims to educate through conversation, highlighting DDA's guiding values of inclusion, status and contribution, relationships, power and choice, health and safety, and competence. With that, enjoy the show.
Welcome to Just in Time. Kenny and I are thrilled to have Joseph Macbeth as our guest today. Joe is the Chief Executive Officer and President of the National Alliance for Direct Support Professionals, or NADSP, and has worked in the field of intellectual and developmental disabilities for 40 years, beginning as a direct support professional. In 2016, Joe was appointed by New York Governor Andrew Cuomo as a member of the Advisory Council for the New York State Justice Center for the Protection of People with Special Needs. In 2017, for the President's Committee for People with Intellectual Disabilities, Joe co-authored the President's Report, America's Direct Support Workforce Crisis, Effects on People with Intellectual Disabilities, Families, Communities, and the U.S. Economy. In 2019, Joe was recognized as a national honoree by the National Historic Recognition Project for significant national contributions in the field of intellectual and developmental disabilities in the U.S. between the years of 2000 and 2020. Most recently, Joe was appointed by President Joe Biden to the President's Committee for Intellectual Disabilities, where he will serve a 2-year term. Welcome, Joe. Thanks for being with us.
It's good to be here, Robin. Thanks for having me.
Joe, let's get started by having you introduce us to NADSP by sharing a brief history, overview, and the organization's mission and vision.
Sure. So the NADSP was founded in the mid-1990s. In 1996, the report to the President from the President's Committee for People with Intellectual Disabilities, each year that committee submits a report to the President. And in 1996, the topic of that issue was the direct support workforce crisis. And I have to add that in 2017, I co-authored that report to the President covering the same issue, which is why I really have a hard time talking about the current direct support workforce crisis in the terms of a crisis, because a crisis is defined as unexpected or sudden or temporary. This is not a crisis where we find ourselves today with the workforce. It is something that has been happening for decades. And from that report in 1996, and by the way, the chair of the committee and the author of that report and the founder of our organization is John F. Kennedy Jr. And John's contribution to the Kennedy family's rich legacy of supporting intellectual and developmental disability causes, his contribution was the workforce. He was really interested in raising the direct support workforce qualifications and skills and ethics. And of course, John passed away in 1999. And then we were housed at the University of Minnesota's Research and Training Center, where we created the Code of Ethics and we created a set of competency areas and an early version of our certification program. In 2011, we were gently booted from the comfortable nest at the University of Minnesota, and they were looking for a part-time executive director, the first employee to be hired. And they did a national search, and nobody applied. And I happened to be on the NADSP board of directors at that point, and was asked if I would be interested, and I said sure. And at that time, we didn't have a strategic plan. We didn't have a business plan or a business model, and it was really a leap of faith to launch a truly singular organization devoted to the direct support workforce. And I'm really proud that here we are 11 years later, and we've grown exponentially. And I believe that our work at NADSP is being taken seriously. I believe that the NADSP is highly respected, and we're starting to see some changes. We're starting to see direct support professionals being valued as true professionals, giving opportunities to demonstrate their skills and earn certifications, and seen as that linchpin between service delivery and service quality. We talk often about quality is defined at the point of interaction. And what does that mean? Well, it means that, every business, every industry has some marker or some goalpost that defines quality. And in supporting people with disabilities, I would argue that that marker or that goalpost for quality is how do we help people with disabilities achieve meaningful outcomes? How do we help people with disabilities achieve things that are important to them in the terms of outcomes? And when you start breaking down and looking under the hood of how people achieve their outcomes, big outcomes or small outcomes, helping people find and keep a job, helping people find and maintain healthy relationships, helping people live in their own homes, helping people be truly included in their communities. Those are outcomes. But how do we achieve those outcomes? So when you look under the hood, you will often see a direct support professional, or more likely a team of direct support professionals doing their jobs. Outcomes don't happen by accident. Outcomes don't happen by magic. Outcomes typically happen through a team of dedicated direct support professionals who use their knowledge, their skills, and their values. And we can demonstrate that in a variety of different ways. But we do know that quality in human services, quality in supporting people with disabilities, happens at the point of interaction, and most frequently at that point of interaction are direct support professionals.
I've been in the field working with people with disabilities for not as many years as you have, but for a significant number of years. Your point that where we measure our success is at the point of service really makes sense to me. And I think probably for all of those agencies and providers that we support through our residential training unit and our quality assurance department at DDA, I think they would all be able to agree with that point. So thank you for that. I appreciate that. Today, what I'm hearing more and more about, Joe, are the NADSP's Code of Ethics. So today, I'd like us to focus on those Code of Ethics. Can you tell us about the development of them and explain why they're important to the mission of NADSP?
They are critical not only to the mission of the NADSP, Robin, but they are a foundation of direct support practice. So the Code of Ethics, every profession, virtually every profession, has a Code of Ethics. And probably the most common one that people know is the Hippocratic Oath that physicians take. And the primary thing, I mean, that's a very long document, but what most people know is, I shall do no harm as a physician. And so in 1999, 2000, when we were being housed at the University of Minnesota, some of our founders, Dr. Amy Hewitt and others at the University of Minnesota, We're working with a broad stakeholder group that consisted of family members, people with disabilities, direct support professionals, agency executives, and researchers to create a code of ethics for direct support professionals. And the code of ethics it doesn't give you answers. The code of ethics is developed really as a compass or a roadmap that direct support professionals and other professionals, by the way, it shouldn't only be for direct support professionals. I would argue that the code of ethics should be embraced and followed by everybody who works in our field. And if you've been a direct support professional for more than a week, you have been confronted by an ethical dilemma. And it provides the DSP who is lost and doesn't really know what to do with a roadmap of how to do the right thing, how to do what's right. Now, let me give you a couple of examples. I was a direct support professional, and I was confronted by an ethical dilemma on my first day on the job, even before I walked through the door of the group home. I was asked to report to a group home on my first day of employment, and I go up to this group home where 8 people lived, and I knocked on the door, and nobody answered the door. I didn't realize it at the time, but that was an ethical dilemma. Do I walk in to that group home because that is where I am employed, that is where I work? Or out of respect for the 8 people who lived in that home, do I wait until somebody invites me into their home? So that seems something so basic, but that's an ethical dilemma. And I could tell you in 1983, I walked in the door. I didn't wait for somebody to answer the door. I think in 2022, I think people are seeing this differently. You wait until you're invited into that group home by somebody who lives there or somebody else who's working there. An ethical dilemma. I didn't know what to do. Now, direct support professionals are confronted by ethical dilemmas all the time. And so we need a framework to help us. It's values-based. So the other piece of the code of ethics is, all of us come to work with our own sense of right and wrong. All of us bring our personal values to our jobs. And it's often really difficult for direct support professionals to separate their own personal values with the values of the work. And in a support job like direct support professionals, it's easy to impose our own values on what is right or wrong onto the people that we support. And a lot of times we are unethical with the best of intentions. Typically, we want what's best. We want to make sure that the people that we support are healthy and safe. Certainly, 2.5 years into a pandemic, we've been focusing on health and safety. So when a lot of times when direct support professionals are unethical, we're imposing from our own professional distance what we believe to be right or wrong. And that's a slippery slope. And I can give you so many different examples of DSPs who are trying to do the right thing, but actually being unethical at the same time. We need to help people with disabilities understand what's right or wrong for themselves and leave our own personal values at the door. And that's why the Code of Ethics exists today.
Hey everyone, Kenny here to say that was part 1 of our 2-part conversation with Joseph Macbeth. On our next episode, we will be discussing the 9 tenets of NADSP's Code of Ethics. Robert and I had a wonderful time talking with and learning from Joseph, and hope you did too. We look forward to continuing the conversation on the next episode, and until then, this has been Just in Time.